As soon as Sunday morning, yesterday, Minister Carman made sure that first we give all the support to the 7 families that were affected, and also to all citizens in Quebec City having a kind of shock after this tragedy. So it's already in place since yesterday morning. Yeah, I've spoken with Mr. Labaume yesterday, and I agree with him that the work of police people is tougher and tougher because they are getting closer to social work. And we have to work together, maybe put in some patrol some social workers. So Lionel Carman and Geneviève are working already on that. Yeah. Okay. Of course, with the pandemic, we see more cases. I think the figures are as high as 15% of Quebecers having mental health problems. It was 2% before the pandemic, so it's a very, very large increase. We've increased the number of people working for helping people with mental health problems, but we'll need to do more. And Minister Carman this afternoon will make some announcement.
Do you worry what the pandemic will do for people in general, people with mental health issues over the next few months? It's getting colder, it's getting darker earlier, people are not really going outside as much given the pandemic. Is there a fear within the government of what impact this could have?
We're no different than other countries. We see that everywhere in the world. You have people, either they are very mad at governments or they have mental health problems also. So we have to be careful. We have to find a balance between saving lives and quality of life of citizens. So it's not easy, but I think right now, number of cases is a lot too higher still in Quebec.
Next question.
Bonjour, Monsieur Legault. Josh Grant, CBC. I want to ask about prevention. Obviously, with all of these lockdown measures in place to keep Quebecers safe, how can we know when people need mental health support, and how is the government going to look to sort of to connect with people who need that help, who need maybe whether it's counseling, whether it's care, whether it's support, and how can people get that support without necessarily being able to reach out?
The first rule, and it's very important, and maybe I'll repeat that in French, but the first rule is we have to help people being alone. You have the right to see one by one people alone. And these are the people that are more at risk of developing mental health problems. So we have to have a kind of follow-up for people living alone. But we are adding services, personnel for treating mental health problems. Of course, it's not an easy choice, an easy balance between those restrictions and the number of deaths we see every day. So it's a balance. All governments are trying to find this balance, but as you can see, most of the measures we have in Quebec, we have the same measures all around the world.